just let everyone in. Hello, everyone. We're just going to give everyone a couple of minutes to join us. Hi, everyone. Thank you for joining us on day 4 of a week of action. This is our roundtable on faith policy and harm reduction. My name is Jose Martinez, and I'll be the tech support for today. So this is brought to you by National Harm Reduction Coalition and Faith in Harm Reduction. And what you see right here is our North Star statement, and it goes: National Harm Reduction Coalition creates space for dialogue and action that help heal harm caused by racialized drug policy. And this is basically just a paragraph of what drives most of our work. And we do policy and advocacy, national and regional conferences, trainings, and technical assistance, and helping agencies become OOPPs, which is opioid overdose prevention programs. And our website, you can download or publish some of our stuff on there. So we're gonna go through some Zoom housekeepings. So if you want to call in with your phone, on the bottom left-hand side of your screen, there's an arrow next to the microphone icon. And when you click that, you want to go to switch to phone audio, and it's going to bring up some numbers depending on what region then you dial that number, insert our meeting ID and participant ID, and it will automatically connect. The chat box, feel free to drop any questions you may have, say hello to your friend, our panelists also. Just be mindful of when you do message, because maybe if somebody direct messages you, it automatically goes so that you write them. If you want to write a general message or want to write something directly to a panelist, just be mindful of the drop box. And you can change your view options also. I like to see one person, so I usually have it on one person. So, but on the top left-hand side, you're gonna see a box that has one box, two boxes, and 9 boxes, and that's the gallery view. You can see about 4 boxes with 2 boxes, and the single one allows you to be on speaker view. And just a reminder that this webinar is being recorded. So anything that you do write in the message box, it will be transcribed. And enjoy the conversation. I'm passing on to Erica now.
Thank you so much, Jose, and thank you to each of you for joining us here this afternoon. We are thrilled to welcome you to the second event in our National Faith and Harm Reduction Roundtable series, and to be participating in the National Week of Harm Reduction Action with our partners. My name is Erica Poellot, and I am the Director of Faith and Community Partnerships for the National Harm Reduction Coalition, and also oversee the Overdose and Drug Use Ministries for the National United Church of Christ. For those not familiar with harm reduction, with Faith and Harm Reduction, we are a collaborative project of the National Harm Reduction Coalition and Judson Memorial Church in New York City. As a national collective of faith and community leaders, we mobilize spirit, connection, and power in partnership with people who use drugs and people who trade sex. We were born of the understandings that there was a call to build bridges between harm reduction and faith communities in order to develop leadership, strengthen harm reduction advocacy efforts, and build environments supportive of harm reduction in policy and practice. As a collective, we have arrived at the following mission, which guides the spirit of our work. Faith and Harm Reduction co-creates a justice movement which connects people who use drugs, people who trade sex, and communities of faith through the development of harm reduction-centered spiritual resources, ritual support, and spiritual care. We can go to the next slide, Jose. Today's webinar, like all of our efforts, is very much a work of love, and this space was made possible by an incredible team of panelists, technical support, Faith and Harm Reduction staff, and in largest measure, our Faith and Harm Reduction leadership team. We can go to the next slide. Today, our conversation will be led by an incredibly impressive list of harm reduction leadership from across the country, including Reverend Sarah Howell-Miller, Jose Martinez, and Jen Sarduy from National Harm Reduction Coalition, Malika Lamont from Vocal New York and Public Defenders Association, also a member of the Faith and Harm Reduction leadership team, Heather Haase with the National Coalition for Harm Reduction Funding, and the new International Drug Law and Advocacy Resource Center in New York. Vinay Krishnan and Jen Flynn Walker with the Center for Popular Democracy. Following the panelists, there will be a time for questions and answers, and we look forward to being in conversation with you. So thank you all for joining us in this movement here today on this webinar. During this week of action, we welcome you, and we will continue to welcome you to connect with Faith and Harm Reduction and our collective work for liberation. And with this, I will turn it over to my colleague and friend, Reverend Sarah Howell-Miller.
Thanks so much, Erica, and thank you, Jose. Before we get started, I'm just going to give us a minute to center ourselves, and we'll keep this really short and simple, but especially in these days of everything being on Zoom and online, it's easy to spend a lot of time in our eyeballs and in our brains and not as much in our bodies. So I'm just going to encourage us, wherever you are, get comfortable in your seat or you're standing or you're wherever, whatever position you're in. Feel where your feet connect to a surface, where your backside connects, maybe if your hands are on a table or your device. And take a deep breath in and release. One more deep breath in and release. And this time as we breathe in, I want you to think or say to yourself, I am worthy. Breathe in. And as you exhale, think or say to yourself, this work is sacred. Exhale. One more time, inhale, I am worthy. And exhale, this work is sacred. And so we hope that you will be as present as you can be during this conversation. We acknowledge and give full permission to be on or off camera, but however you need to be able to show up in this space, we are so glad that you're here. And Jose has a poem to share with us as we move through our ritual moment today.
Hi. You can hear me? Good. I wrote a poem. I feel personally, in order for a person to become, better, you have to question yourself. And basically that's basically what the poem is about. And I hope you enjoy it. It's called Question Yourself. Question yourself. What's success if you fail to be happy and sound? If you can't live with yourself, how can you capture the crowd? What's going to happen when there's nothing left but your cap or your crown and you have to depend on yourself while they're laughing you down? Question yourself. Are you going to stand up and be proud, or when the chips fall, curl into a big ball and tap when you're down? What's your character like when you make a mistake? What's your level of contribution to this world? Do you give or you take? How do you treat the flaws in your most insignificant place? Do you look for more when you haven't finished your plate? Are you leading with love or living with hate? What do you stand for when you're in a privileged place? Question yourself. Question every decision you make. Because you come from the swamps doesn't make you a snake. And if that's how you were conditioned, it doesn't mean that it's right. Because it's insight, it doesn't make it insight. Question yourself in your moods that are dark like midnight. Sometimes a bright shine comes in the form of a dim light. I question myself so I can understand what flies by me. I learned the only question I shouldn't ask is why me? Because it could always be worse, and some people have it that bad. Some people looking for dinner in trash bags. Some people overdosed and never made it back and got tagged and thrown in black bags. So who am I to complain that I'm flying and can't land? I question myself because I want to be perfect, when in reality, I just need to question my whole purpose. Thank you.
Thank you, Jose. Thank you so much for sharing. We can go to the next slide. Grateful for that offering. So in leading up to this Harm Reduction Week of Action, one thing that Faith and Harm Reduction did was we started a campaign we're calling Harm Reduction is Sacred. And this is an invitation to folks to create harm reduction altars. And we're defining altars very broadly here, but we wanted to, in case you had not seen that invitation, and to set us up for something we are going to do collectively together on this Zoom call, I wanted to take you through what our Faith and Harm Reduction National Leadership Collective came up with around harm reduction altars. So Jose, you can go to the next slide. And the next one, there's my title slide. So we are compiling images of harm reduction oriented communal and personal altar spaces, and you'll get to see some examples of those in just a few minutes. And those are still coming in. This is an ongoing campaign that we are going to continue to invite people to participate in over time. And through this campaign, we're affirming that harm reduction is sacred work and that people who use drugs and people who do sex work deserve access to sacred space. Some of our leadership collective members have named that this is something that has been denied to people in many ways, and that Faith and Harm Reduction hopes to encourage people to reclaim for their own. Next. So to kind of answer the question of what is an altar, there's no right or wrong way to create an altar. And so here is some inspiration that our collective came up with. So an altar is a visual display of any size. It's something that you build on purpose, intentionally, something with meaning and intention. We talked about an altar as a place to put it down, whatever it might be. An altar is a physical touchstone for prayer, ritual, memorials, desires, grief, joy, intention, personal or community care, etc. Next. So why a harm reduction altar? An altar is a place to lay down what's heavy and pick up needed strength. A harm reduction altar grieves lives lost to the racist war on people who use drugs. And this is how we often see altars, as ways to remember people we've lost, and that is an important use of this tool. But we want to expand that to say that a harm reduction altar celebrates resilience and insists on the worth and deserving of the oppressed. A harm reduction altar resists anti-Black violence and imagines / co-creates a new, more just world. And a harm reduction altar motivates us to act for needed change. So it's not just a symbol, it's a catalyst for change, which is what we're talking about today around policy. So where to create your altar? An altar might be a public or communal creation or an at-home personal space. And we'll see examples of both of these. We have altars that have been created in syringe access programs, in homeless shelters, as well as just on people's dressers in their bedrooms and everything in between. So you might create your altar on site at a harm reduction agency built by and for people who use drugs. If you're a faith leader or community member, you might build it in or near your worship space. You might build it in a part of your home that feels safe, in a corner of your dresser, as I mentioned, or in an outdoor space. Next. And so how to get started, we offered up these questions for individuals and communities to get started around creating a harm reduction altar. So what are you grieving or celebrating? What do you need to put down? What justice, care, or action is needed? What do you and your people deserve? What is elemental of the earth that might ground you and your altar? And what ordinary objects remind you of spirit, goodness, resistance, and truth? Those are just some starting points. So what we're going to do today, and this is an idea that came from Blythe Barnow, who works with Faith in Public Life and is a member of our National Leadership Collective. I know Blythe is in the car, but on our call today, but I just wanted to give credit. We are going to build an impromptu virtual altar in this Zoom room. So what I'm going to do is I'll invite you all to do one of two things. You might either find an object that you would like to contribute to this collective altar, or you might find pen and paper to write down a word. So these might be objects or words that remind us that people who use drugs and people who do sex work are worthy and beloved, and that harm reduction is sacred. And to be sure, when we say sacred, that might mean religious, but it might also just mean set apart for a specific purpose or something that is meaningful or life-affirming. And so I'm going to give us just a few seconds to go and find an object or a pen and paper. So just to give you a few ideas, I have a candle here. I have a Narcan. I've got some syringes. I've got this YIMBY, yes in my backyard sticker. And then I have, little prayer rope with a cross on it for my faith tradition. Anything that will affirm the sacredness of harm reduction. Let's just give maybe like 30 seconds or so, and then I'll invite everybody to hold that up at the same time. So wait for my cue. I'll give you a few seconds to gather your objects or words. And Jose, if you can maybe stop screen sharing for a minute, and we'll go to gallery view so that we can all sort of see one another. Okay, is everybody ready? Let's hold up the objects and we'll create our impromptu altar right now. Beautiful. I see a bedazzled sharps container. I see a mug. I see prayer flags. I see a candle. I see the word breath. I see a book. I see a candle that looks like mine. I see our faith and harm reduction prayer cards. This is wonderful. I'm going to scroll through and see. Take a second and just look at everybody's objects. Awesome. Thank you all so much. You can put those down. So we do encourage you to, wherever you are personally or communally, create a harm reduction altar. And if you haven't done so already, send us your pictures. We're going to continue to collect these and share these out to encourage folks to reclaim sacred space for people who have often been pushed out of it. And next we have a video of some of the harm reduction altars that we've already created and shared. So Jose, you can, is the audio shared too? Great, thanks Jose. Thanks, Jose. You can go to the next slide. So receive this, this blessing of harm reduction altars. May this harm reduction altar be blessed. That is, may its inherent goodness be acknowledged. May it embody the truth that harm reduction is sacred, that is, set apart for a purpose, recognized as vital, understood as life-affirming. May this altar be an active reclaiming of sacred space for people who use drugs and people who do sex work. May it be a place to put down whatever is heavy and to take up what is needed and deserved. May it be a touchstone for prayer, for ritual, for memorials, for grief, for joy, for intention, for resistance. May it mourn losses and celebrate resilience, challenge unjust systems, and inspire us to dream of and work for a new, more just world. May this altar be a reminder that people who use drugs and people who do sex work are worthy, beloved, enough, good, holy, sacred, and free. May it uplift grief with demands and embody a call for justice, care, and action. May it signify and move us to enact liberation, liberation within our own hearts, minds, and bodies, liberation to more authentic relationships and communities, liberation from institutions and systems that oppress, liberation to inhabit spirit, goodness, truth, and solidarity. May this harm reduction altar and all who engage with it be blessed. And now I'm going to turn it over to Michelle Wright to talk with us a little bit about the week of action that is ongoing.
Yeah, thank you. This is really amazing. I didn't know I needed this until you started this whole altar thing, and I'm not even very religious, but it just felt very calming and peaceful, and I needed that, so thank you. I'm Michelle Wright. I use she, her pronouns, and I'm the Director of Advocacy and Policy at the National Harm Reduction Coalition. And I'm super excited that all of you are joining us today. This is part of a series that's been named a couple times as the Week of Action. At the end of last year, there was an idea to, how do we create spaces and opportunities for folks to come together and kind of expand everyone's understanding of what harm reduction is. The new administration was coming into office for the president, and there was a lot of synergy around people wanting to name, we obviously don't want what happened in the last administration, so we need to organize together, band together, and, build connections across the movement because there's been so many silos. And so we started planning the Week of Action with collaboration between People's Action Overdose Crisis Cohort, Vocal New York, the Drug Policy Alliance, and NHRC. And it's been such an awesome experience over the last few days, having folks share out at teach-ins. People's Actions have been instrumental, and I know Ellen Glover is on the call right now. Just organizing folks together, expanding folks' understanding of what harm reduction and drug policy reform could look like if we work together, and then shifting the public narrative about the overdose crisis and the drug war, and hopefully moving people to action, getting them excited about small wins, low-level victories, so that when it comes to the big stuff and we're able to kind of meet again in person, that people are ready to take action. They have the courage, they have the energy, and we're ready to work across movements. So I'm especially happy to be here with you all today. I'm glad the roundtable lined up, but this just is going to create more opportunities for us to work together, to build up those bridges and break down the barriers that have kept us in silos for too long. So I will add it to the chat, but there's more events that are happening later today and tomorrow, but I'm very excited to be here with you all today.
Thank you so much, Michelle. We are so grateful to be a part of this. So last month, Faith and Harm Reduction launched this a virtual roundtable series, and we started with an event on harm reduction in the Black church, and we were really excited that our second event got to line up with this Week of Action so that we could focus on policy and how faith communities can support and take action for harm reduction policy. So I think Michelle did a great job of introducing what we're doing, and that is our sort of short summary. So I think we're just going to go ahead and jump right into our speakers for today. So our first speaker is Malika Lamont. Malika is the program director with Vocal Washington and project manager with the Washington State Lead Expansion Team. Malika has worked to address social determinants of health for over 20 years. In September 2019, Malika received a Community Champion Award from Malina Healthcare of Washington that was awarded to people whose leadership, volunteerism, and public advocacy embody the spirit of service and community. She holds a bachelor's degree at Xavier University of Louisiana, as well as a Master of Public Administration degree with a focus in public health policy and nonprofit management. Malika has worked as a licensed adolescent counselor and family care coordinator in Tacoma, the Washington Initiative for Supported Employment, Thurston County Public Health and Social Services with the Syringe Exchange Program, and as a project manager at the Public Defenders Association with the Law Enforcement Assisted Diversion. She's a founding member of the Washington Association of Syringe Service Programs and Full Circle United, which is also involved in other movements for social good. Malika is a member of the National Faith and Harm Reduction Leadership Collective, so we're so grateful to have her speaking in this event, and she's going to share with us some about some decriminalization efforts and other efforts that she is a part of in Washington. So welcome, Malika. We're glad that you're with us today.
Thank you, and thank you everybody for your time today. So we're in Washington State. I'm the director of Vocal Washington. We work in collaboration with Vocal New York. We consider ourselves the little sister. I think they consider us that too. We have been intimately involved with policy change that we're working on here in Washington State. I'm going to talk with you a bit about the decriminalization work that's happening here in Washington, as well as the intersections that have occurred with faith communities throughout our state. I think a lot of times, often people think of Washington State, you think of Seattle. And Washington geographically is very diverse. We have deserts, we have, coastline, we have Seattle, and then there's the rest of the state. There's urban centers generally surrounded by suburban and rural areas. Seattle is the population center in Washington, but the ethos of Seattle is not representative of the whole entire state. So hopefully people will leave with a little bit better understanding of like what we're facing here in Washington State and how it is not what you always hear about in Seattle. And I'm sure that this dynamic is repeated throughout a lot of areas, and the ways that we've been able to incorporate our work with faith communities has been integral to changing the harm reduction focus throughout our state. So first I'm going to talk with you. So in the middle, so this legislative session, we started off with, I'm going to share my screen and share some of our work around an effort called Pathways to Recovery that we have been working on, that was a decriminalization initiative, legislative approach that also would have expanded our treatment throughout the whole entire state and recovery supports and harm reduction activities throughout our state. And it was in collaboration with the ACLU and Treatment First Washington. And our whole goal was to improve the response to substance use disorder and also to the real issues that people are facing around, experiencing homelessness. And in Seattle, like I said, there's a lot of will towards addressing those things. In the rest of the state, it often looks like the people that are experiencing the complications are the ones that get blamed. I think that's something that people in rural areas oftentimes can identify with. And what was different about the Pathways to Recovery Act is it was an opportunity to engage the rest of the state in looking at building up resources and responses throughout our state. And this is really, like, in a nutshell what it was that we were looking at, what I'm sharing in the screen. And it died in the legislature, and part of the reason it died is because we were asking to decriminalize simple possession as part of the bill. And then our Supreme Court did something called the Blake decision, literally within like 2 weeks of when our bill, we were like, well, we'll come back again next year. Our Supreme Court decided that our simple possession law in Washington State was unconstitutional, and they struck the whole entire thing down. And we were like, oh, all right, this is time to mobilize our efforts and continue to push forward. And it was really an interesting opportunity, because through the work that we had started with the Pathways to Recovery Act, we had been able to pull in faith communities in a way that they hadn't necessarily been engaged in this process before. Particularly, I live in Thurston County, Washington, which is about 70 miles south of Seattle, and it's where our state capital is located. And in our area, faith communities are integral in providing services throughout our community. They are the ones that oftentimes spearhead much of the harm reduction work. That is where our low barrier shelter is housed. They were the ones that championed that movement when there was a lot of NIMBY activity and at times violent opposition to harm reduction activities that were occurring in our community. But they held strong. Interfaith Works is the organization that houses that program, and also our community care work around. We had a community care center where people could engage in healthcare if they wanted to. There were, showers. There was like all of these different everyday things that people need, and it was staffed by individuals from Interfaith Works. And then also south of us in an area called Lewis County, there's another church that it's called Gather Church, and they house many of the social services in their area as well. Lewis County is a very conservative area. They have a low barrier buprenorphine clinic there. They house all of the homeless outreach services. They were the first community-based naloxone provider in that county. And they also help people get connected with housing and other services if they need them, healthcare. So there's a lot of ways that our faith communities are really showing up in positive ways throughout our state in order to further harm reduction work in our communities. And they also were part of the Care First coalition that was a part of the Pathways to Recovery Act. They all testified in support of the act when it was in front of the legislature, and they were holding space within the community to have broader conversations about this work and to push and advocate for it. And now I'm going to share with you where we're at now. So in Vocal Washington and also the Care First Coalition has been trying to lobby to proceed with care post-Blake, because there is a faction, even within what would be considered the progressive caucuses of our legislature that is controlled by Democrats, to go backwards with the Blake decision and make it illegal again for simple possession. There also is, there are moves afoot to make it, to have criminal sanctions associated with possession of simple possession of substances. Washington State had one of the most regressive laws around simple possession. I think a lot of times when people think of Washington, they think that it's very progressive because we are the place that had, the first sanctioned publicly funded syringe exchange program in the country. We have done a lot of firsts that are very progressive, but we also have very regressive laws. So for example, our police use of force law was recognized by Amnesty International as being one of the most egregious in the entire country. That was changed a couple of years ago with an initiative called 940. We also have one of the most regressive tax structures, meaning that poor people and marginalized people carry the burden of the tax burden in our country, in our state, even though we have people like Bill Gates and Amazon and all of them. So there's a lot of, we have a long way to go in order to achieve equity in our state. And we were hoping that with the Blake decision, we also have now one of the most diverse Supreme Courts in the country. And we were hoping that things would be able to move forward, but we're seeing a huge backlash to go and a lot of disinformation around how to handle the Blake decision. So just telling all this information to kind of give you a background of like where we are in the policy, realm around this. And also to dispel any myths that y'all have that like Washington I mean, we are all that in a bag of chips to a certain degree, but we're not. Anyway, we're very conservative in some ways too. And so one of the things that they have been putting forward is that we need to invest hundreds of millions of dollars into the criminal legal system in order for them to let people go and to expunge their records. We do believe, of course, that people should, they have a right to the relief that they deserve as a result of this decision, because this is retroactive as well. So in Washington state, since 1971, when our simple possession law went into effect, there have been about 500,000 people that have been impacted by our simple possession statute. And so people would need to gain access to relief as far as expunging their records, getting their LFOs reimbursed to them, and also getting their scores or their points reassessed. As far as sentencing points, we have a system in Washington that does that. And all of those are necessary things. However, we don't believe that investing that money in the system that created those inequities is the place where we need to put the money. We think that we need to build out services, housing, stock, and a number of things throughout our state. And so those are the things that we're advocating for and pushing towards. We're hoping that there will create a consolidated process and in order to create the relief that people deserve, but not park hundreds of millions of dollars into the criminal legal system so that they can expand the harmful influence that they have already created. We have taken a social determinants of health lens. So recognize, and that's seems to be the way that resonates best and easiest with our legislature when we're talking about these issues around decriminalization. And it helps people see all the different areas that one decision can impact. And I think those are buckets that people mostly can understand. The things that we have focused on the most are economic stability, neighborhood and physical environment, community and social context, and the healthcare systems. And we have created like this priority investment framework for our legislators. It has gained some traction. There was a bill that was dropped actually yesterday, I believe, our Senate Bill 5476, if people want to look at it, like if there's stuff that work that you're replicating throughout your states. And it's sadly, it would be putting limits on personal use, which is what we were trying to stop. Because right now there are, as a result of the Blake decision, there's no particular limit for personal use amount. However, there are other laws on the books that the Supreme Court did not touch that mention amounts related to distribution. But the misinformation and disinformation campaigns that are going on as a result of law enforcement right now are saying that, you know, you could just have pounds and pounds and pounds of these drugs and there's nothing we can do about it, which, you know, if you're going for full legalization, I'm like, as long as people are safe, then what's the problem? But, you know, but we also have to operate within the framework that we have at this particular time. But one of the things that we're really advocating for in our area is to get a 988 crisis system. So instead of going through normal 911 dispatch that would include law enforcement, we want to create a dispatch that can be connected to 911 if necessary, but that is focused on a crisis response system. So redesigning that and having it directed towards behavioral health crisis so that we can interrupt a law enforcement response to things that are not appropriate for law enforcement to be responding to. We are hoping that there will be a no wrong door referral process where referrals for service can come from the community, pre-booking diversion if people are involved in lead. That's another piece of work that I do as well with expanding law enforcement assisted diversion or let everyone advance with dignity throughout our state. We received funding a few years ago to expand that model into communities outside of Seattle, King County. And actually they are some of the most healthy systems, healthy programs in our state right now are the ones that have been expanded. And an interesting note is a small community, small rural community that is about 40 miles from where I live. They out on our peninsula in Washington state. So if you look and you see that little part where the little leg thing comes up on the state, out there, they started a LEAD program. And when the Blake decision came down, I was calling all the outreach workers that I knew, making sure they had enough Narcan so that when people were getting out, they were going to have what they needed. And within 15 minutes of calling the outreach worker in that area, she called me back and was like, we actually don't have anybody locked up on simple possession because everybody was diverted out as a result of our LEAD program. So that's one way that shows that there is a synergy that can be achieved with these diversion programs. It also demonstrated that that simple possession is not this savior that a lot of times people that don't understand harm reduction think that it is. People oftentimes really truly believe that drug laws keep them safer. And so that's one of the things that we're really working on, is helping people understand that a prohibition-based system actually makes things less safe and makes individuals that use drugs less safe. It makes the community less safe, and it makes distribution of resources harder in order to address the issues. The other priority investment area that we're really focusing on is outreach and case management for individuals, and recognizing that those systems need to be expanded, not just for the individuals that are experiencing the immediate effects that potentially their disordered substance use might be causing for them, or chaotic substance use, but also to their families and the rest of the community. And that people need to be able to have, we need to have a broader response system that is paid for, that will meet the needs of individuals. And we don't have super significant investments in those areas in Washington state. We've done a pretty good job with our Medicaid transformation, with being able to pay for treatment services for those that want them, but we have not made as meaningful of investments in outreach and case management. And then also in housing and recovery supports. I mean, I don't think it's news to anybody that, in the United States, we're about, I think the HUD report said that we're about 40% under what we need for stock of low income housing in this country. And Washington is no different in that. So we're asking that they're going to make significant investments in the housing and recovery support, and then that the final area of investment would be expanded treatment and behavioral supports. One of the things that we were advocating for in House Bill 1499 was expanding payment through Medicaid for psychedelic therapies for individuals, because we know that that is innovative and being recognized as good practice for treating, different behavioral health issues. But there's really not a mechanism to be able to pay for it unless you have a lot of money. And so we're saying that those modalities should be available to people regardless of what type of insurance that they have or their income. So those are some of the things that we're looking at. As far as we're recognizing this is our alternative version for what relief would look like without pumping hundreds of millions of dollars into the criminal legal system. We would be asking the Supreme Court to put forward emergency rules and or legislation establishing a process for the situation that we're facing around past convictions, and that there is a mechanism for individual cases that need it, but that we could just do massive vacation of records, and that prosecutors would make clear that they will not pursue Class B drug cases, because unfortunately what we're seeing in some of our more conservative areas is that people were pled down to simple possession, and now that law is has been stricken, they're wanting to go back and potentially charge people with the higher offense that they were pled down. So we're trying to occupy the field we're asking the legislature to occupy the field so that that can't happen, because we already have jurisdictions that have stood up their own local laws to make things illegal again. And we don't want it to be a justice by geography situation that we're already seeing pop up in our state. And this literally happened like the end of February, and it has already, I mean, within a month, you're seeing this happen already. And then we're asking them to really take the challenges that we have before us seriously. And, you know, for people that need resentencing because their criminal history score may have changed, that have making it so that it's something that can be done without individuals having to go back to the county that they incurred the original charge in. So we're asking them to also look for people that are held in our Department of Corrections to make them the top priority, and to start looking at in order to rescore so that they can get released. We know that that's about 7,000 people at this particular time that are impacted directly by this decision right now, that are currently incarcerated.
Thank you, Malika. We are a little behind on schedule, so if it's
Sorry.
okay, I think we might move on to our next speaker, and then we can come back with any questions. But thank you. This is such great work, and we're really, really happy to have that shared with us today. Thank you. So our next speaker is Heather Haase. Heather is a harm reduction and drug policy reform advocate based in New York City. She is currently the coordinator for the National Campaign for Harm Reduction Funding, a growing coalition of organizations that advocate for government resources for public health organizations involved in addressing the needs of people who use substances across the United States, and Faith in Harm Reduction is one of many proud partners in that. Heather has been involved in advocacy for harm reduction reform primarily at the international level since 2011, when she began collaborating with the National Harm Reduction Coalition to advocate for harm reduction policies at the Commission on Narcotic Drugs in Vienna, Austria. Heather has worked with the International Drug Policy Consortium, IDPC, since 2013, advocating for public health and human rights-based drug policies at the UN in both New York and Vienna. In 2014, she led the formation of the New York NGO Committee on Drugs, a UN-affiliated organization that works with the Vienna NGO Committee on Drugs to facilitate the engagement of NGOs working in the drugs arena in UN events and developments. Heather is now combining her international work with U.S. advocacy around harm reduction funding through the formation of a new International Drug Law Advocacy and Resource Center in New York. IDLARC will continue advocating for harm reduction and human rights and public health-based drug policies through the National Campaign for Harm Reduction Funding and other domestic and international initiatives. Heather holds a law degree from Wake Forest University School of Law, which is in the town that I live in. She earned an LLM concentrating on drug policy, international law, and human rights from Columbia Law School in New York City. She lives in Manhattan with her husband and 9-year-old daughter. And welcome, Heather. We're so glad to have you with us today.
Thank you, Sarah. That was. I know that was a little bit of a mouthful, so thank you so much. And I've been meaning to tell you that that I lived in your town for a while. But thanks for the invitation, and this has been really great. I especially love the altar as well. So Malika talked to you guys about where we are in the policy, and I'm going to talk a little bit more about the funding. Since we do work on funding. And I just also want to make clear that this is not the part where we ask for donations or anything like that. This is really more about the community, what the need is for harm reduction funding, what we're doing about it, and sort of what's been accomplished and what we hope to accomplish, and how the faith-based community can be supportive of that. So first, just a little bit about the need for harm reduction funding. You know that harm reduction is vastly underfunded, as you might guess. I know that's probably a shocker. You know, organizations are very resourceful in finding their funding, and many are funded already by small grants from state governments. But they really do hobble along with very little funding, and the community as a whole is way underfunded. Most of the funding, at least from the federal level, which is where we're putting our focus in, goes to treatment and prevention. So there's some 18 billion to treatment and prevention every year, and that's good. And we're not saying that's not good. That's a good thing. We support that. That's a lot too. And we get that there's some good resources going towards drug-related services, but The truth is that 80% of people with the substance use disorder are not only not receiving treatment, but they're not even seeking treatment, and may never be seeking treatment, may not need treatment or want treatment. That's 80% of the people with substance use issues. And you know, with the overdose crisis so severe now, you know, this is a population that's very vulnerable to fatal overdose, vulnerable to many other health issues, and is often unstably housed. There are many ways to service this community. And that's what the harm reduction organizations across the country do, service this, this community of people who need services that are not being reached by the current funding. The harm reduction organizations, you know, can obviously deliver clean syringes, naloxone training, distribution, many other health services, and housing services. So there's a vast array of the kinds of services that can be delivered to people who need them in this population. And this, the funds that I'm talking about that go to treatment and prevention are not even including, and I'm not even hoping to quantify today, the funds that go to policing and criminal interventions in these communities, which, as you know, is also quite vast. And I think we can all agree that many of those interventions are very costly and they're ineffective. So for many reasons, but in terms of health costs, harm reduction services are efficient. They're efficient for communities and they help people. I know that I'm preaching to the choir a lot on some of these issues, but so what are we doing about that? So about in the last year, I think this started maybe a couple of years ago, but really in the last year, there were three things that really prompted this community to come together to organize this campaign. One was, of course, the promise of a new administration. We didn't know yet, but we hoped that there would be a change in administration and that this new administration would be much more open and welcome to the science behind overdose prevention and other harm reduction services. The second was the challenges and opportunities of COVID-19. I say opportunities because, as we know that, we know that COVID-19 really exacerbated the overdose crisis and many other drug issues. It also presented some opportunities in terms of relaxations of distributions of medications for such as methadone and buprenorphine. So those are the things that's what I mean when I talk about the opportunities of COVID-19 that we now hope to see extended. And then the third was really this national, really international awakening that's been happening that was spurred by the deaths of George Floyd and Breonna Taylor and others. So we felt that those things, particularly the last, really have illuminated this need to make that shift away from traditional enforcement, policing-based drug policies towards a more public health-based, science-based approach. And that is going to require funding. And so we thought now is the time really to come together and to really coordinate around and focus on this need for harm reduction funding at the federal level. So we did that. We came together, we wrote a letter, we gathered sign-on organizations. We got about 60 sign-on organizations in a fairly brief period of time. And as the new administration was coming in, we lobbied them from several directions. We weren't the only ones, so we had the support of the community. But we did lobby them for a single stream of harm reduction funding. We asked for way more than as it turned out we got, but it seemed at the end of that effort that they were listening, that they have heard us. And as part of the American Rescue Act, the Biden administration, the Congress through the Biden administration pledged $30 million towards harm reduction services. This is a big win, although like I said, I recognize that the amount for some was quite disappointing, or some said it felt like more of the same. It was really the breakthrough here was that this was the first time that the words harm reduction, like next to each other, had been used in a press release from the main federal drug agency, ONDCP, and also in the legislation used harm reduction. So although this is, I think, a little bit of a subtle shift, it really does signal a shift by the federal government and Congress to at least looking at harm reduction and entertaining, the value that it could bring. And that is something that, believe it or not, is just something that has been missing from this arena for a long time. So, I mean, there are the two cons, which is the amount was not what people were expecting, and there are some administrative issues. So we will have to probably engage in a lot more advocacy just to make sure that those funds go to the organizations that they should go to, and that is supposed to go to the local organizations who are actually doing these services. So we're very happy about that, and as we look forward, we're really excited to do much more advocacy around funding. We have asked for $15 billion over 4 years, and so there is obviously much more work to be done. There's been talk amongst us about, and in the community, about putting together a national strategy on harm reduction, similar to the National HIV/AIDS strategy, which would basically, in effect, standardize the implementation of harm reduction nationally, and result in a little bit more cohesive and focused efforts in every state. So the possibilities are really endless in terms of what we could accomplish. So how can the faith-based community engage and support these efforts? I sat down and gave that some thought today. And first of all, I just think it's so important that you guys are supporting us as much as you have, because I think that people really listen to faith-based communities. It's a very powerful demonstration when the harm reduction community gets support from faith-based communities. So some of you have already signed on to our letter and joined the coalition. So it is an open coalition. We are looking to be very all-inclusive. So one way to join us is to sign on to our letter, which is on our website, and join the coalition, come to our meetings, hang out and see what day-to-day you can do to engage and help. But the other things are just supporting harm reduction in your own communities. That could be, of course, it could be financially, but it could also be providing space for harm reduction activities or events or discussions, for dialogue. And also to continue to, as some of you have, talk about harm reduction in a positive light. I can't emphasize how important and powerful it is when someone from the faith-based community talks positively about harm reduction. It makes a huge difference given the stigma that surrounds substance use now. It helps to normalize harm reduction, mainstream it, and basically shows that compassion for people who use drugs is acceptable and is something that we should have. So and people listen to what you say. So and you can also, like I said, join our coalition. We have a Facebook page and a Google group, and I think that's about it. We're looking forward to a lot more advocacy around this. We'll be working on these issues for a while to come, so we really welcome you to join us.
Thank you so much, Heather. Next, we have Jen Flynn Walker, and she offered to introduce herself since we're getting a little behind on our schedule, which I think is partly my fault, but thank you, Jen.
Hey, no worries. Hey, everybody. Thank you so much for inviting me here. My name is Jen Flynn Walker, and I was the founder and director of Vocal New York, so it's cool to have lots of vocal people on here talking. And I've been an organizer for 28 years, and my first paid organizing job was actually at the Lower East Side Harm Reduction Center. So I really feel very grateful to be in this space. I work right now at the Center for Popular Democracy, and we are a network of 57 of the most badass community organizations, across the country. And we aim to build a tent of people, caregivers, members of the faith community, staff from social service organizations, and of course, always at the center of everything that we do, led by people who use drugs, for a project that we call the Opioid Network. So you all know that the overdose epidemic, would be the largest public health crisis facing our country right now, killing nearly 100,000 people per year. It's, deadlier than the AIDS epidemic at its peak. If we didn't have COVID, and before COVID, it was the #1 cause of death for Americans under 50. And this crisis isn't going away after we all get vaccinated. And as you know, overdose is only on the rise, fueled by the isolation of COVID. So what I'm here to say is we need a movement. People are dying because of government inaction, and we should all feel called to take action. And I'm here to organize you. So the Opioid Network is a diverse, multiracial national network of drug users, advocates, service providers, leaders, grassroots groups fighting for the fairest and most effective public health solutions to the opioid epidemic. Our members live and work on the front lines of the overdose crisis in towns, cities, and states across the country. We bring them together with a broad array of community organizing groups that see the opioid epidemic, quote unquote, as a public health crisis that requires public health solutions, and that is developed and led by drug users themselves. And we believe in the power of moral, nonviolent direct action. Recently, for the past 4 years, many of our members put their bodies on the line to defeat efforts to get rid of access to healthcare, to destroy the healthcare system. And, honestly, a lot of the healthcare system has been decimated, particularly the public health infrastructure. But something that we're really excited about is, we've been able to bring together all of these groups to work at the federal level and to win some pretty big stuff. And as Heather, we're also a very proud member of the National Coalition for Harm Reduction Funding. So thank you, Heather. And as Heather explained, we won $30 million, not enough, but definitely a great investment for harm reduction organizations. But I want to say this very clearly. We also won $7.6 billion. I didn't misspeak. That's with a B. That's the, extra many zeros, for community health workers, including harm reduction outreach workers. So, and there's other funding too, which I can go into. We're going to actually have an event sponsored by the National Coalition for Harm Reduction Funding on April 8th at 6 p.m. So I encourage you all to come, and we'll talk about all the funding that is now out there. So again, I am here to organize you. We are reaching out to members through organizations, door knocking, clipboard outreach when we can, when we get vaccinated, using Facebook and other social media advertising to bring people together, in one tent, under one voice, to really win everything that we can to address this crisis, this public health crisis, and to build the movement that we need to match this moment. So I know following me is my colleague Vinay, and he will pick it up and talk a little bit more about some of the things that we're fighting for, some of the specific policies. So I thank you so much, and I look forward to fighting alongside it with you.
Thank you so much, Jen.
Not fighting with you, you know what I mean?
Yes, we get it. Thank you so much. Glad to have you. And our next speaker is Vinay Krishnan. As Jen mentioned, he works at the Center for Popular Democracy as the national field organizer. Since I'm the moderator, I get to take these personal privileges and note that Vinay and I discovered we overlapped at Duke for 6 years. He went to law school, I didn't, but we're really glad to have him, and I'll turn it over now.
All right, thank you so much for having us on, and thank you, Jennifer, for kind of setting the stage on what we're working on. The only things I'll add to what Jen said in terms of specific policies, because I know Jen has to hop off soon, but one big thing we're working for is the CARE Act, which is the most ambitious approach to overdose legislatively in the country. It's a Warren-Maloney bill. It's $100 billion over 10 years investing in harm reduction, investing in treatments. And we love it because it takes a public health approach to this crisis, not a criminal justice approach, which I'm going to dive into more in a second. So that's one thing to keep on your radar. We've been working hard with Heather and other activists to get that harm reduction funding, $30 million, which again is very small, but let's remember that this is the first time in American history that we've had a funding stream exclusively devoted to harm reduction. So that's a big, insert curse word, deal, big deal. That's great, that's awesome. And we're gonna keep working with Heather and everyone on this call to get more money into that in the next budget and beyond. So that's one thing we're working on. We're also working in response to the Pennsylvania federal case, which banned safe consumption sites. We're trying to rewrite the Controlled Substances Act to exclude people doing harm reduction work from that piece of legislation, so people won't be prosecuted for doing safe consumption. And we're also working to hold the Sacklers accountable for their role in profiting and fueling the opioid crisis. And we're working to make sure they're not using procedural tools to escape liability for their harm that they've caused. So just wanted to outline a couple of those policies, but I wanted to spend most of my time, and I'll be brief because I know we're running a little bit behind, but I wanted to talk about, what is the reason we only got $30 million? What is the reason this is the first time in American history that this has happened? And I think the reason is stigma. I think that's the biggest stumbling block. Jennifer and I have done dozens and dozens and dozens. Jennifer's probably done hundreds of lobby visits with representatives about the CARE Act, about all the policies I just, outlined. And the number one stumbling block is people on both sides of the aisle, Democrats and Republicans, seem to think that people who use drugs, these are not lives worth saving, right? These are not people we want to invest in. These are not active citizens. These are not people who are going to vote. They're not going to rally. They're not going to come out, and support us. And we know that's not true, but they don't believe that. So what can we do to make them believe that? What can we do to eliminate that stigma? And again, this is stigma for people who use drugs. This is stigma for people who engage in sex work, stigma for people who have mental illnesses and disabilities, all the populations that are affected by the work we're doing, right? So what can we do to eliminate that stigma? And I think faith communities can play a huge role in that. And I'm going to circle back to that at the end. But if you look at the national approach that we have to overdose, our national policy itself is stigmatizing, right? Because we're responding with policing and prisons and violence, and that's all stigmatizing. So how do we shift from that to a public health approach, which I know Heather talked about? We can't make that policy shift until we erase the stigma. And then even within groups who are taking a public health approach, there's a more specific stigma, right? That, okay, yeah, we want to combat overdose, but only with abstinence only, right? Only, you can't have a criminal record, you can't be engaging in sex work. There are all these like specific stigmas that we have to engage in. And Heather mentioned that 80% of people who use drugs are not actively seeking treatment, right? So we need to address that population. These people who want to continue using drugs, there is inherent dignity in that population. So how do we destigmatize that and make sure that those people are staying safe, that they're not overdosing, that they're not spreading disease? That's all stuff we want to be working on. And then one more big picture point is, if you take like a look back at this moment in history, right? 2020, 2021, if you set Trump aside for a second, what were the defining moments of these last year and a half? It's been the police uprisings, the effort to defund police and abolition, and it's been healthcare, right? And obviously this is work that's gone on for generations, but the movement to defund police has entered the public consciousness in a way that it never really has before. And if you think about universal healthcare, Medicare for all, harm reduction, that's entered the public consciousness in a way that it never really has before either over this past year. And I don't think that's a coincidence, right? Because it's not two stories, it's one story. When people say, what do you do without police? What does that look like? What do you replace it with? Well, the answer is we replace it with a country in which everyone has what they need to thrive, right? And that means housing, it means education, and it means healthcare. So for this population, it means harm reduction. So what does that look like? Well, instead of a police officer responding to an overdose at 3 o'clock in the morning, what if a harm reduction worker is? Instead of a police officer responding to a mental health crisis at 3 a.m. in the morning, what if a mental health professional is? So that's the world that we're envisioning and we're trying to get to. But we can't make those shifts without first eradicating the stigma. So for me, like the defund movement is inextricably tied to universal healthcare, and harm reduction is very much part of the same story. So if we agree on that kind of stage that we need to combat the stigma, what better place to do that than a place of faith, a place of worship, a place of community. So to all the religious leaders, all the faith-based leaders watching this, I would really challenge you to ask yourself, how can you create a community that honors the dignity of people who use drugs, that honors the dignity of people who engage in sex work, that honors the dignity of people who have disabilities, who have mental illness, and not to respond to them in a punitive way or a place from judgment, but a place that embraces them and keeps them safe, and keeps them going and honors the inherent dignity that all of their lives have. Yeah, so I think Heather and Jen outlined a lot of that. And just one last point that I'll make before I sign off is that all of this, everything I've talked about is heightened for BIPOC folks, right? It's heightened for people with mental illnesses, people with disabilities. These are racial justice issues. So this is disability rights and disability justice issues. The same populations that are so often left behind, who are struggling more now in COVID than they ever have before. They're more affected by job loss, more affected by losing health insurance. Overdose rates are higher than they've ever been. Suicide rates are climbing because the COVID crisis is a mental health crisis. So this is very much an emergency. It was the great public health emergency of our time before COVID and will be again after. So we need systemic solutions to these systemic problems, and combating stigma is a great way to start. And I think everyone on this call, everyone in faith-based communities can play a huge role in doing that. So thank you.
Thank you so much, Vinay. That was awesome. We're so grateful to have you. And last, I'm going to turn it over to Jen Sarduy, the Communications Manager with National Harm Reduction Coalition.
Hey, y'all. I know we're almost out of time, but I'm so excited to chat with everyone today. My name is Jen Sarduy. I use they or she pronouns, and I am coming to you from Kickapoo Land, Fort Worth, Texas. I am the National Harm Reduction, the National Harm Reduction Coalition, the communications manager at the National Harm Reduction Coalition. So I do back end education stuff and work with our teams to make sure that the work that they do can be shared by our community, really in a spirit of mutuality and a spirit of continuing the important message of harm reduction and making it accessible, in ways that, I don't know, visionary communications can do. I really work a lot with co-design also, and designing processes with people instead of at them. And I think that's so important for a harm reductionist. And other hats that I wear are I organize with ODAID Fort Worth. We are a team of 5 folks organizing harm reduction and syringe access in Fort Worth. Syringe access is legal in Texas. And so we have great personal risk under organizing an underground harm reduction program. At any time we can be, arrested or subject to state sanctioned violence, and so can our participants. And so one of the things that I talk to faith partners about a lot is how we can raise our risk level. So much of how we experience solidarity these days is in the form of Facebook posts, and we need to take solidarity offline and really talk about how we can raise our risk level to meet the people in our community and people who use drugs. We struggle really hard to pay, not only to have the supplies our participants need, most of whom are houseless. We meet them weekly with syringes and Narcan. Our police department has a whole storage unit full of Narcan that they won't use because the risk that they would undertake in reversing an overdose is greater than they're willing to. So they just won't give that Narcan away. They won't use it. It's just sitting in storage. And I really work in my community to like kind of see how I can match the risk of the most disadvantaged people in like my community and the most misrepresented folks in my community. I also organize with Rebirth Equity Alliance. I'm the co-founder. It is a reproductive justice group organizing like mutual aid HIV testing kind of things and skills sharing, skills building. I train care providers nationwide on how to provide like actively anti-racist care. And I do work in my hometown, in this town, about reimagining our public safety budget. A lot of like what Vinay was talking about and how we can reimagine public safety as unarmed first responders, as, you know, like fully staffed schools with counselors instead of cops. And we have like all kinds of graphics and design devoted to that kind of thing. You can look up Fort Worth Futures for that kind of design. And in that vein, in the like pursuit of harm reduction in my town and being a person who used drugs and a parent that like refuses to pass on a world that doesn't have like the resources we need to survive, I'm also running for city council in Fort Worth. I hope to create a world where we have the resources that we need to thrive, where we can like grow instead of gentrify, where we can like collaborate instead of like using clout, where we can, you know, house people instead of harassing folks. And where we can like really look towards justice instead of jail. So much of the time we're like having this conversation about policing, and what happens is that like I know in Fort Worth, the police, we spend $1 million a day on policing, and the police have the majority of our budget, period. Not our public safety budget, they have the majority of our budget, period. And when that happens, right, when that's the power like structure that we're in, that means we actually never get to have a conversation about safety. We only ever get to talk about policing. They have the majority of our money. We don't get to like really ever think about what makes us feel safe. We get to think about like what makes us feel policed. And so I really like think about how we can all work to support people first policies. Local politics is like where so much of the federal stuff like meets the point where our lives, like how that feels in our neighborhood, right? And so it's important that like our faith communities are engaging their local like representatives, because that affects like those moral points. Like our budgets are moral documents, right? And so those moral points are like nonpartisan points where we can agree and affect how these like how policy feels in our communities. Maybe local politicians aren't setting like the federal laws, but they sure as hell are choosing what to enforce. We know that like governments just ignore the laws that are inconvenient to them all the time, right? And so it's important that like using that kind of focus of like, this actually is about our morality and our future and our ability to thrive and have the things that we need to drive like how we're like moving policy forward and supporting people first policy. I like support policies that like and policies and programs that design with and use the spirit of mutuality. Nothing about us without us, you know. Skills building so that we're creating systems of care that can sustain our neighborhoods without creating additional harm, right? So we want to skills build conflict resolution with our community. We want to skills build facilitation with our community, right? How are faith communities engaging in skills building with their communities so that we're getting stronger together, and just, yeah, centering on co-design. I guess that's what I got for you today. But thank you so much. I had a great chat.
Thank you so much, Jen. And thank you to all of our speakers. I know we are just at time, and I want to give a minute for Erica to share some action steps with us. So we are not going to have time for questions and answers, which I hate when that happens, but it also tells me that there was a lot of really important stuff that needed to be shared, and that probably we need to do this again. So thank you all for being with us. And just to call back to our harm reduction altars earlier, those are not just things to make that are that are pretty or cool. These are things to call us individually and collectively to action. And so much of that action has been named by our speakers. And then I'm going to invite Erica Poellot to share with us more. And we are going to email all of you with a recording of this event, along with links to a lot of the websites that have been referenced here and the campaigns that have been referenced, as well as action steps so that we can all stay involved and connected in this movement.
Thank you so much, Sarah, and thank you everybody who has joined this conversation. Special thank you to our speakers. I am remiss that we do not have time for questions, but share the spirit that Sarah lifted up, that it meant that there was incredible conversation happening, and we will ensure that we find ways to continue to invite you into conversation with us. As we close, we wanted to close with a call to action, and as Sarah indicated, we will be sharing all of this with you as part of a cumulative Harm Reduction Week of Action toolkit. So as individuals and as representatives of diverse faith traditions, we celebrate the Harm Reduction Week of Action and the commitment to the work of love in solidarity with people who use drugs and people who trade sex. Every person is precious. We, faith leaders and representatives of faith-based organizations, believe that fundamental to each faith is the respect of human dignity and the value of human life. We are at a critical juncture in the movement to give life to a world where the war on people who use drugs has been abolished, where communities of health, wholeness, and justice are being co-created, where people who use drugs and people who trade sex experience community rooted in love and are leading a thriving harm reduction movement. So now we move to put our faith into action, to mobilize our faith in harm reduction. We commit to taking significant and sustained action to, 1, reduce stigma and discrimination. We will launch stigma reduction campaigns in our local faith communities, in our organizations, which address both stigma and discrimination against all people who use drugs and trade sex, particularly BIPOC and other criminalized and marginalized communities. 2, increase access to harm reduction. We will work with other community-based organizations, with governments and other stakeholders to ensure that harm reduction services are available in communities where we have a presence, and that the services are delivered without stigma and discrimination and under the leadership of people with lived and living experience of substance use and sex work. We will ensure harm reduction is robustly resourced, both monetarily and spiritually. Understanding that budgets are moral and values-based documents, we will advocate for funding for life-giving, life-affirming harm reduction and community-led care strategies. 3, defending human rights. We will actively advocate for the elimination of discriminatory laws and policies affecting people who use drugs, and will seek to provide care safely in areas where such laws and policies are still in place. We will respect the human dignity of each person, ensuring that human rights standards for all guides the global response to health and justice issues impacting our communities. And 4, promote the leadership of people who use drugs and people who do sex work, centering the voices and wisdom of people who use drugs, people who do sex work, especially Black and Indigenous people of color, and we will compensate people for their labor. Next slide. We will hold ourselves mutually accountable for our actions by setting specific goals and by tracking progress in community and conversation with one another. We call on faith leaders and organizations to join us in this commitment to action, to use the Spirit of Harm Reduction Toolkit and the included Guide to Action to build congregations of care and justice in your community, to use this call to action and the Week of Action Toolkit to influence local, national, and regional decision-making processes on harm reduction and drug policy reform, to join the Faith and Harm Reduction Action Network, to join our partners, National Coalition for Harm Reduction Funding, Center for Popular Democracy, and Vocal New York. Together, we can abolish the war on people who use drugs, end the overdose crisis in this moment. With this, We bid you go in peace and go in power. Be well.